Dr. Eric Janssen is a board-certified orthopedic surgeon specializing in sports medicine with an emphasis in knee and shoulder surgery. He recently presented a program on shoulder injuries and treatment options and took questions from the audience. In this video, he responds to the following question. Once a clavicle fracture has healed, can the plate and screws be removed?
It's variable, particularly with the clavicle. There's not much skin and soft tissue that covers that up. Recently, most of these companies have come out with much thinner plates that are strong enough that won't break. That was the whole thing. They used to be very, very thick plates. And so when we put a plate on, it's normally sitting on the top, and we try to do our best to cover the tissues back over top of it to give some thickness and covering to that. But most patients, even if they're a heavier patient, are still pretty thin there. So normally what we'll tell the patient is after it's healed, hey, you can leave this plate and screws in, but if it bothers you, and females sometimes because they wear a bag over top or something like that, will say, it just doesn't feel good to me, I want to get this thing out. Rarely do the screws back out now and do crazy things like that with these new locking plates, so that's good. So the answer is you can leave a plate in, but we tell the patient, if you want to take it out, we might want to wait a year and then get it out. If it's still bothering you and giving you problems. Sometimes we'll actually throw the plate to the front depending on the fracture. Now we've got these new front plates, so that hides it a little bit better. Most hardware, like if you're deep in the shoulder, they don't really notice that, and most times you can leave that in unless there's a problem with the hardware where something broke on it or screw backs out and starts causing problems, then we'll have to go get it. But most times we can leave it in.
For more information on the diagnosis and treatment options of shoulder injuries, go to sportsmedalabama.com, or to make an appointment with Dr. Janssen, call 256-881-5151.